I'm Dr. Michael Patterson, clinical psychologist and EMDR Europe accredited senior trainer. I run trainings and workshops for experienced mental health professionals. In this video, one of them is asking me a particular question. Please join us.
Hi, sorry, Liz Morrison. My camera's not working, unfortunately.
But I can hear you loud and clear, Liz. So Liz, what's your question?
Well, it was just a follow-up on that, because I've seen other clinicians, when you're talking about the butterfly movements, would you reckon it's the patient that's doing it, not the therapist? Because I've seen therapists do it.
So if the therapist is doing it, it might be have a nice calming effect on them. So maybe some therapists in those sessions do need it. But for clients, if they're doing the tapping, certainly you could do it to model it for the clients to copy. But if the therapist is the only one doing the tapping, it's not going to benefit the client whatsoever. So they may as well go out and flap their arms outside for all the good it will do, to be perfectly honest. So with that then, the important thing would be for the client to be doing the tapping.
Right, okay.
Now, so whether they cross their arms over like this, left, right, or whether they're tapping their knees themselves. For example, I had a client there recently who had a shoulder injury, and I had him starting off like this. I could see he was going like this, and I said, "Have a breath, what do you notice now?" And he said, "Well, the image is eased. Any feelings in your body?" "Yeah, I've got this sore shoulder, and that's that injury." I said, "Well, of course you came in with that, didn't you?" And he said, "Yes." I said, "Well, would it be any more comfortable on your shoulder if you were to tap the tops of your legs?" So he tried that, and he was doing the eye movements at the same time. So that worked really well for him.
Okay, thank you. Sorry, it just took me by surprise, because the way I was trained was that we did the tapping, on the patient's knees or on the top of their hands.
Oh yes, I've got you now. Yes. Well, if we're in the ship's passing in the night position, then you could do the taps. And if it was doing, let's say, doing the tapping the back of the client's hands or between their hands, I would always put a physical barrier on their lap, their hands sitting on top. So there are some who would quite happily tap the client's knees, but I suppose that this sort of leads on to a potential hazard for us as the therapist. Now, as an EMDR therapist, we are going to take a good history whenever the client comes in. So we want to understand what's happened in the client's life, and the clients could be quite good at that. They could tell us about all the experiences that they can recall, but they may have a memory of, let's say, abuse, which has not been available to them in their conscious awareness. It could be behind a dissociative barrier. So we as the therapist, with the best will in the world, wanting to help our clients process, if we were to just tap the client's knees, particularly with their hands, for example, or even between their knees, then there is a chance that for some clients, then that might link to some unresolved trauma, because knees attach to thighs, attach to torso, and processing could go in different directions. And when we start off, we don't know what the client is going to link to in terms of the processing. So I would certainly suggest, to be on the safe side, it's always better to have a physical barrier between the client's hands and their lap and tap their hands then.